Having an abdominal fat or central obesity, or what we call muffin top, is getting very prevalent nowadays. It is related to obviously metabolic imbalances such as lipid dysfunction. Most people call it the spare tire, and almost everybody has it when they reach middle age. The question is why? This is Dr. Lam, founder of drlam.com. In the case of adrenal fatigue, we do find that a lot of people have central obesity. Now, we know that part of it is metabolic reasons, as we talked about earlier, but part of it also has to do with cortisol. And cortisol is regulated by the adrenal glands. What happens that we know is that when you have adrenal fatigue, the cortisol are put on overdrive in order to help the body deal with stress. Cortisol receptors are actually very, very dispersed throughout the body, but more so in the central area. And in fact, it's many more times cortisol receptors in the central part of the body as compared to the peripheral part of the body. So the body's proportion changes as in accordance to the cortisol receptors, because there's a tendency to attract the fat to where the cortisol receptors are. Why? It's because the fat and cholesterol are necessary ingredients to make cortisol. So this is a vicious cycle. The body is trying to make more cortisol and is using various different parts of the body to store, to manufacture, to transport, and to synthesize not only fat but also cholesterol. And the best place that the body can think of is in the tummy, where it is resting and is not used as frequently as in the peripheral musculature. So we still see an association. We're not saying that central fat propensity is equal to adrenal fatigue, because that's certainly not the only option. But many people do have adrenal fatigue, and when the adrenal fatigue progresses, there's a tendency to develop central obesity, and we have to know that. And some people are already put on statin drugs, etc., when they come on board with understanding how adrenal fatigue really is related. So we have to be cognizant of the fact of these things, because when a person is on medication for these central obesity or lipid profile irregularities, it can affect the rest of the body. So understanding that central fat is actually a normal, somewhat phenomena, as the body tries to hang on to fat in this effort to conserve energy and deposit it in the central part of the body, is important symptoms not to be forgotten. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.